All right, let's jump right in. Today, we're going to unpack a real medical detective story. It's a puzzle that often kicks off not because of a patient's complaint, but because of a medical scan for something else entirely. We're talking about bilateral adrenal masses and the incredible investigation that follows.
So picture this. You go in for, say, a CT scan for some back pain, and your doctor comes back with something completely unexpected. They found something, all right, but it's not on your spine. They've spotted a mass on your adrenal gland. In the medical world, they have a name for this, incidentalomas, basically accidental findings. And just like that, a medical puzzle has landed right in your lap.
Now, usually this kind of thing only pops up on one gland, but where it gets really interesting and what our story is about today is when it happens on both. And that happens in about 10 to 15% of these cases. Believe me, that one little detail, it changes everything. It kicks off a way more complex, way more urgent investigation.
Okay, so that's where we're starting. An accidental find that just opens up this whole can of worms. Like, what even are these glands, and why is it such a big deal to find growths on both of them?
All right, first things first, let's get our bearings. Your adrenal glands are these two small but super powerful organs that sit right on top of your kidneys. The best way to think of them is as the body's stress hormone factories. They're responsible for pumping out essential hormones like cortisol, which handles stress and metabolism, and adrenaline for your fight or flight response. They are just absolutely crucial for keeping your whole body in balance.
So you can imagine, right? When a doctor spots these unexpected growths on both of these vital little factories, well, the alarm bells start going off. Are the factories just, working a little too hard? Or is something way more dangerous taking over? The list of what it could be is surprisingly long.
And this is where the doctor's toolkit comes in. See, when they're faced with a mystery like this, clinicians don't just guess. Nope. They follow a really specific, step-by-step process to dig up clues and figure out what's going on. Let's walk through it.
You know, the first big hurdle is just how many things this could be. I mean, look at this. On one hand, you've got possibilities that are totally benign, basically harmless stuff like a simple adenoma or a cyst. But on the other side, you've got some really concerning things like metastases, which means cancer has spread from somewhere else, or rare tumors like a pheochromocytoma or even lymphoma. The stakes are obviously incredibly high.
So how do you possibly sort through all of that? Well, there's a clear diagnostic path. Step 1, analyze the images. The size, the shape, the density of the masses on the CT scan, those are your first clues. Step 2, run the hormone tests. You got to check if the factories are malfunctioning. Are they producing too much or maybe not enough? And finally, step 3, based on what you find, you might need to bring in the big guns, like genetic testing or even a biopsy. To really see how this plays out, let's dive into a few real case files.
All right, let's look at our first case file. I'm calling this one the overachiever. You'll see why in a second. This is where the real detective work kicks in.
All right, so here's what we know. We've got a 73-year-old guy. He's got a history of high blood pressure and type 2 diabetes. He goes in for that back pain CT scan and bam, just like we talked about, the scan flags these masses on his adrenal glands. If you look at the image, you can see them right where the arrows are pointing. And so the investigation is on.
The next move is hormone testing, and this is where they find the smoking gun. The patient's urinary metanephrine levels are off the charts high. So what does that even mean? Well, metanephrines are basically the leftovers after your body uses adrenaline. So if you see super high levels of them, it means the body is just getting flooded with adrenaline-like hormones. That factory isn't just working, it's an absolute overachiever in total overdrive.
Okay, let's put the pieces together, right? You've got growths on the adrenal glands, and those glands are pumping out insane amounts of adrenaline. What kind of tumor does that scream to you?
And there it is. The diagnosis is a pheochromocytoma. It's this rare kind of adrenal tumor that just churns out massive amounts of catecholamines. That's the hormone family that includes adrenaline. This totally explains his long-standing high blood pressure, and it's a really serious condition that has to be managed. But now they know. Case 1, solved.
All right, let's crack open our second case file. This one's really cool because it shows how a totally different kind of clue, this time a genetic one,
can be the absolute key to solving the whole puzzle.
So for this one, we've got a 68-year-old man. And again, the discovery was an accident, this time during a scan for abdominal pain. But what's different here, and you can see it on the scan, is how it looks. It's not just one single mass. The report actually describes multiple little nodules all over both glands.
So the hormone tests here are, well, they're interesting. They show what's called mild autonomous cortisol secretion. Basically, the cortisol factory is a little bit overactive, but it's nothing crazy like our last case. But here's the twist. The real game changer comes from step 3, the genetic testing. It finds a specific problem, a pathogenic variant, in a gene called RMC5. And that is a massive clue.
So you're probably asking, why is one little gene so important? Well, it's because it helps doctors tell the difference between two conditions that can look almost identical. Finding that specific ARMC5 gene variant points the finger squarely at one diagnosis in particular: primary bilateral macronodular adrenal hyperplasia. That's a mouthful, I know. But it just means the whole gland gets enlarged and filled with nodules. The genetic test was the ultimate tiebreaker.
And just like that, we have our diagnosis. It's not just a guess from the picture, it's a super precise conclusion, and it's backed up by hard genetic evidence. This means the treatment can be tailored just right to control that mild hormone overproduction. Case 2, solved.
Okay, for our last case file, we've got a real curveball. I'm calling this one the imposter, and you'll see why. The problem here isn't actually coming from the adrenal gland itself. No, it's something that's moved in from the outside and taken over.
So our patient is a 69-year-old man. Now the scan shows these really big masses on both glands. But his symptoms, they're strange. He's losing weight without trying. He's dizzy. That doesn't really fit the picture of a gland that's working overtime. It's a big clue that something else is afoot. And this is where the puzzle gets really tricky. The hormone tests come back and, get this, they show his adrenal glands are failing. His cortisol levels are super low. I mean, that is the exact opposite of what you'd expect with huge tumors, right? The factories aren't in overdrive, they're shutting down, and that means something has gotten inside the glands and is literally destroying the healthy tissue.
The final piece of the puzzle had to come from a biopsy, and the diagnosis was a real shocker: B-cell lymphoma. It's a type of blood cancer that had spread to his adrenal glands and just taken over. It was an imposter, a cancer masquerading as an adrenal tumor, and that's why the glands were huge but failing. Making that distinction absolutely critical for getting him the right treatment.
Wow. So, after walking through those 3 incredible cases, what have we actually learned? What are the big takeaways from this whole diagnostic journey? Let's sum it all up.
First up, remember that these masses are usually found completely by accident. Second, a really careful look at those scans is always the first, most critical step. Next, it's good to know that the most common cause is actually a benign lesion, but even those can be making a few extra hormones. And because of that, there's no one-size-fits-all treatment. It's all about the individual patient. And finally, just like we saw in that last case, you always have to think about imposters, things like infections or cancers that have invaded the glands, especially if the glands seem to be failing.
You know, this whole process is just a beautiful example of methodical investigation in medicine. It's how doctors turn a complete chance discovery into a diagnosis that can save a life. And it really makes you wonder, right? What other medical mysteries are out there just waiting for the right set of clues and a curious mind to piece them all together? Thanks for joining us for this explainer.